Hello, my name's Sarah, and this is my story. It's to make everybody breast aware. I've recently, 5 weeks ago, noticed my nipple was leaking. I've got no lumps, no illness, no nothing. Did the usual, went and did a pregnancy test, make sure I'm not pregnant, because that's the only time previous to this that I've had any nipple leakage. That all came back clear, so I went to the doctors. The doctor told me it was probably an infection, gave me a course of antibiotics, told me if it wasn't clear within a week to go back, well, to ring her and she would refer me for a mammogram. So I rang her the following week because it was still happening. Not excessive amounts, just a tiny bit of leakage, hardly anything really. And she referred me for a mammogram, which I got within 10 days. I went for a mammogram, had an ultrasound, and they saw something on it. I then had 8 biopsies done. Went back for the results and got told that I've got like a cyst in my milk duct that I'd got to have removed. I've been today for my pre-op to be told that my biopsy came back as a B3 biopsy, which means there's malignant cells, but they can't say for definite that it's cancer. It could be benign. So the operation that they're doing is taking the cyst away and the tissue around it so they can biopsy it all thoroughly. The reason I'm doing this is because most people expect lumps in the breasts if there's anything wrong with the breasts, and there's no lumps whatsoever. You wouldn't know, I wouldn't have known there was anything wrong apart from the nipple leakage. So I just want everybody to be aware. I'm now going for surgery on Friday to have this mass removed, and then 2 weeks after that I'll go for the results and find out whether it's cancer, if so what grade cancer it is and what further treatment I'd need, or whether it's just a cyst of some sort. So everybody, what I'm saying is you need to check your breast. But I have to say the NHS have been brilliant. It's by the time I have my operation, it'll be 5 weeks from me first noticing it to going and having it removed. I will do an update after I've had the operation and that to let you know what it is. Just to keep people informed, because there's that much information about check your breast for lumps, but there's no information about anything else. People expect if you've got breast cancer you'll have a lump, but that's not always the case. Now I'm hoping that mine's not breast cancer, but the likelihood is that it's a form of breast cancer or precancerous cells. I've had to today been and bought a post-op bra, which is very fetching, as you can imagine, but you know, needs must. It's better for it to be removed and that threat to be taken away, even if I have to have follow-up treatment. It's something that's got to be done, but like I say, fingers crossed, hopefully there's nothing there and it is just a cyst in my milk duct, but we shall see. But the information I've been given by Derby Hospitals has been very, very limited, which really hasn't helped, because then your mind runs away with you, and as we all do, we turn to Dr. Google, and whatever you Google from Dr. Google, you're always dying. It doesn't matter what you Google, you can always make your symptoms fit. So I will post an update when I feel a bit better from the operation, probably after my results, to see what the next step is.